Welcome back. In the chapter of preventive medicine and obstetrics, pediatrics, and geriatrics, in today's session, we are going to discuss about the battered baby syndrome. The battered baby syndrome is also known as Kefi syndrome, shaking baby syndrome, infantile whiplash syndrome, and non accidental injury. So let us understand the definition of battered baby syndrome. It is defined as a clinical condition. So it is a clinical condition in the young children, usually under the 3 years of age. The children less than 3 years of age, they have received violence on one or more occasion. It could be one time or multiple times, including the trauma by the parent, guardian, or foster parent. So we see that it is a condition. What is battered baby syndrome? Battered baby syndrome is a clinical condition in the children less than 3 years. They have usually under the 3 years of age, they have received violence by their parent or their guardian, or who is a foster parent. Foster parent is the one who have adopted the baby for a short period, temporary, for the temporary period. When the adoption occurs, adoption is usually permanently. Foster parents are those who keep the babies for certain uh, you know mm, interval. Like for example, your relative could be your foster parent, or somebody who's taking care of the baby for certain for few years, or the certain period could be the foster parent. And it is the violence which is received on one or more occasions, including the trauma which is given by the parent, guardian, or a foster parent. Now the battered baby syndrome is the most commonest cause of death in the fatal child abuse is the head trauma. In the fatal child abuse, when this child abuse is occurring, the most commonest cause of death is the head trauma. During this abuse, the head trauma leads to the death. Okay. So let's revise, guys, what we studied. Battered baby syndrome is a clinical condition. Usually under 3 years of age, they receive the violence on one occasion or more occasions by the parent, guardian, or a foster parent. It is also known as, very important, we have MCQ. See, we have 4 MCQs on this. It is also known as Kefi syndrome. Very important. The other names of, the battered baby syndrome. MCQs of what? The pre-PG examination, NEET examination. Okay, for the PG examinations, various entrance exams, we have the battered baby syndrome. The other names, they are Kefi syndrome, shaking baby syndrome, infantile whiplash. Okay, infantile whiplash syndrome, non-accidental injury, because it is done in one or more occasions. It is violence which is done on the baby, so it is non-accidental injury. So you can see the picture here. Okay, the battered baby and how the whiplash injury. Okay, it is also known as whiplash injury, battered baby syndrome, or shaking baby syndrome. You can see violently the baby is shaken, so shaking baby syndrome. And non-accidental injury, because it's not accident, it is violence which is done. So this is about the battered baby syndrome. Now let us understand the features of the battered baby syndrome. It is the various features include the skull fracture. We have diastatic fracture with the eggshell calcification. You can see here the sutures, the diastatic skull fracture, eggshell calcification is also observed. Okay, eggshell calcification is observed. And then we have in the next the feature includes the metaphyseal fracture. You can see here in the picture the x-ray. When you take the x-ray, because of the violence, the long bones, the metaphysis of the long bones, you can see a hairline fractures, as well as a small fracture here which has occurred. It is the metaphyseal fracture. So what did we see? The first one was the skull fracture, diastatic fracture with eggshell calcification is observed. Diastatic, okay, diastatic fracture along with the eggshell calcification. Then metaphyseal fracture. Then we have frequent shaking leading to subdural periorbital hematomas. You can see the subdural and periorbital hematomas which are occurring, and you can see the shaken baby syndrome. It has a triad where there is retinal hemorrhages, brain swelling, subdural hematoma. Okay, you can see even in this picture, and the retinal hemorrhages. So this is the frequent shaking of the head leads to the subdural and periorbital hematoma. You can see in the picture here, periorbital hematoma. So this is the shaken baby syndrome. It is also nothing but the battered baby syndrome. Next, we have the multiple fractures on the ribs. So, three fractures, guys. The first one is the fracture of the skull. Second, the long bones metaphyseal fracture. The third fracture we are seeing is that of the ribs. You can see the various fractures which have occurred here. Let us zoom the picture. And the calcification leading to the beaded appearance. You can see the round appearance here. The calcification occurs after the fracture, leading to the beads of string appearance. Okay, it like the beaded appearance, you can see, because this is because of calcification. Okay, that is nothing but the callus formation after the fracture. So the callus formation with the strings of bead appearance in the multiple fractures of ribs. And lastly, 6 penny bruises. It is caused by fingertips because of the scratching, and the baby's skin will be so sensitive, and you can see all the marks here. I don't know how violently they can hit the babies, but battered baby syndrome is found. It is done by their parents, by the guardians, and also by the foster parents. So we can see here the 6 penny bruises which is caused by the fingertips in the picture. Since picture based questions are now very frequently asked in the entrance examinations, it is very important for you to know this is shaken baby syndrome. If they give this picture, you have to mark the shaken baby syndrome or the battered baby, and this is a diastatic fracture of the skull, and the next picture metaphyseal fracture. Three fractures you have to remember. What are those? The skull fracture, metaphyseal fracture, the rib fracture. Lastly, then we have the shaken baby, then frequent shaking which will lead to subdural and periorbital hematoma. Periorbital and subdural hematoma. And the last one is penny bruises. 6 penny bruises you can see on the skin. Okay, various marks caused by the fingertips. So this was about the battered baby syndrome. Also, guys, in additional to this physical injuries, there could also be the deprivation of nutrition in order to identify. Now, for example, if the baby is come with subdural or periorbital hematoma and you are suspecting it to be a battered baby syndrome, you also can verify the same by noting that there will be deprivation of nutrition. There will be deprivation of care and affection in the circumstances which will indicate that the deprivation could not be accidental, but it is done violently and intentionally. So it is found in all the stratas of the society, starting from the higher socioeconomic condition people to the lowest socioeconomic condition. It's found in all the stratas. Its incidence is found in all stratas of the society. So this is all about the battered baby syndrome. I hope everything is clear. And regarding the MCQs, we have many MCQs on this in the previous papers. The other names of the battered baby include Caffey syndrome, shaking baby syndrome, infantile whiplash syndrome, and non-accidental injury. Non-accidental injury, infantile, okay, less than 1 year. Baby less than 1 year is an infant. So we have infantile whiplash syndrome, shaking baby syndrome, Caffey syndrome. Okay. Next MCQ we got was the skull fracture, diastatic fracture with the eggshell calcification. Then next we had another MCQ, that is frequent shaking in the baby leads to subdural and periorbital hematoma. The multiple fractures on the ribs resulting in the strings of bead appearance is because of the callus formation. And the six penny bruises, they are caused by fingertips. Very important. We have an MCQ. You have to remember the six penny bruises, they are caused by the fingertips. So these were the MCQs which were found, and if you like the video, hit the like button and subscribe. Thank you.